helped a woman with severe arthritis drop her chronic knee pain from a 9 to a 1 using hypnotic techniques backed by peer-reviewed scientific research. She still has the same arthritis on her x-rays, but now she walks pain-free. Coming up in this video, I'll explain why this can happen and how she and I did it, the common misconceptions that keep millions of people in pain, and give you some practical, easy self-hypnotic tips that you can use to reduce your own pain, regardless of your condition. My client came to me through a recommendation from someone else I had helped. We had a meeting over Zoom first to see if I could help her. She had arthritis in her knees, her right hand, and the pain was so bad she couldn't walk well and it was keeping her up at night. And she also had electric shocks, sensations in her stomach, and aches in one foot and one hand. She had survived cancer and she really wanted to get on with her life in a healthy, positive way, but the pain was seriously holding her back. So I liked her right away because her focus on getting better gave me the confidence that I could help her. So we booked in 2 sessions online. I work with people here in Switzerland, but it's nice to work online because then I can help people like this client who live in another country. Now, before I break down what we actually did in our sessions, you need to understand what makes this technique work so well to lower pain. It's not about ignoring pain or distracting yourself or coming to peace with it. It's about understanding the neuroscience behind pain. Back in the 1980s, when MRIs became common, many doctors thought that they had finally cracked the code. If you could spot the damaged tissue, you could explain the pain. Simple, right? But then something strange happened. Lots of people with no pain at all started showing major abnormalities on their scans. Things like herniated discs, arthritis, degeneration. The images looked awful, but the people felt fine. And the reverse also happened. People with intense pain often showed no more structural damage from people not in pain at all. That discovery confirmed some other research that had been accumulating about pain. It showed that pain is not a direct measurement of injury. As you age, people tend to have structural abnormalities like disc degeneration, osteoarthritis, tendon tears, muscle injuries, and most people don't notice because they don't have pain. Even a lot of young people have structural deformities that they never notice because their bodies adjust and it just doesn't hurt. I went to the chiropractor years ago for lower back pain, and in the initial scan, he rattled off to the assistant all the things wrong with my spine, starting at the top and going down to the bottom. It was horrifying. It seemed like every vertebra had something wrong with it. It turns out almost nobody has a perfect spine. In my case, the chiropractor adjusted me and gave me some relief that lasted a day or two, but years later, I completely got rid of the pain. When I realized that you don't have to have pain just because your back is messed up. I could have scraping discs or whatever without pain. But how can this be, right? Because if I hit my thumb with a hammer, it sure does hurt. You get injured, it hurts. Everybody knows that. That's what we think we know. But what I'm about to tell you will blow your mind. The human body does not have pain sensors. None. It has sensors for pressure, temperature, and chemical changes, but pain itself is created by the brain. When you injure yourself, your nervous system sends messages up to the brain, and the brain makes a judgment call. Are we in danger? It's a bit of a simplification, but in essence, that's what happens. At least 3 different parts of our brain interact to decide if there should be pain, where it should go, and how severe it should be. The brain doesn't just use that information though. It checks a lot of other inputs, like what you see, what you know, what you expect, and the brain can be tricked. Rachel Zoltness, a clinical professor at the University of California, San Francisco School of Medicine, talks about the tale of 2 nails. In 1995, the British Medical Journal reported on a 29-year-old construction worker who suffered an accident after jumping onto a plank. A 7-inch nail pierced his boot clean through to the other side. In terrible pain, he was rushed to the hospital and sedated with opioids. When the doctors removed his boot, they found a miracle. The nail had passed between his toes without penetrating his skin. There was no damage to his foot, no blood, no puncture wound, not even a scratch. But make no mistake, despite the absence of injury, the pain was real. In a second nail story, another construction worker was using a nail gun when it unexpectedly discharged and it clocked him in the face. Other than a mild toothache and a bruise under his jaw, he thought he had been pretty lucky. 6 days later, 6 days of eating, sleeping, going to work, he went to the dentist And much to his surprise, they found a 4-inch nail had been embedded in his head. In fact, the nail had penetrated his cerebral cortex, which is pretty dangerous. But because all the clues around him didn't put his brain on alert, his pain system stayed quiet. When I lived in Ghana, West Africa, a lot of people there had never used hot water. They bathed in room temperature water because it's warm there. No need to heat it. One time, one of the employees had to use our shower because theirs was broken. And when the hot water came on, they screamed in pain. And that was the same shower that I've been complaining that never got hot enough. Same nerves, same physical input, completely different brain reactions. If the pain were just about the nerves, we'd all feel the same thing. But we don't, because pain is about brain perception, not just sensation. Pain is the brain's estimate of how much danger we're in. When an injury first happens, the pain's pretty accurate because we see what happened, we see the blood or hear the crack. The brain decides there should be pain, and it puts it on a virtual map of our body, kind of like sticking a pin in a voodoo doll. And we feel it right there where we're supposed to. That's why a soldier with an amputated leg can still feel excruciating pain in a foot that isn't there. In the brain's pain map, the foot is still there. Notice if you've ever broken a bone, how much it hurts. Then you go to the doctor and they x-ray it and they put on a cast, and suddenly the pain goes down. It's still broken. It hasn't healed yet. But your brain says, okay, we're out of danger. And sometimes the opposite happens too. The injury has healed as much as it's going to. There's no more danger, but the brain keeps the pain signal going based on something that has nothing to do with sensory input. If you have chronic pain, you've probably noticed that the pain tends to move around, sometimes even to the opposite side. It's like the brain's marker on the map got smudged. It can't quite remember where to put the pain. So let's get back to my client. She has pain in her knees, electric shocks in her stomach, an ache in one foot and in one hand. At the start of the session, she rated her pain as an 8 out of 10. And that's good. A lot of clients say 15. As I start asking her questions, I'm trying to find out why her brain, or her unconscious mind, as we hypnotists like to say, thinks she still needs the pain to keep her safe. There are conscious stories we tell, and there are unconscious stories we may not even be aware of. This is kind of like detective work. She told me the pain was because of arthritis. Her knees are worn out, she said, but the pain was much worse in the right knee. Of course, I had to give her the whole brain creates the pain spiel to start the process. Sometimes it takes a while because when you're in pain, it's hard to believe that your own brain is causing it. Think about how opioids work, though. They don't go heal your bones. They go up to your brain and change the way the brain interprets things. Her pain story was pretty classic. She was getting older and her body was wearing out. Everybody thinks that age brings pain, but as we know from the MRI research, that just doesn't play out. My knees are old, she said. So I challenged her a bit. But both knees are the same age, right? How come one hurts more than the other one? So the first step is to break down the medical story. Injury equals pain. Anyone over 40 is going to have all kinds of degeneration, bones touching bones, slipped, squashed, abraded, whatever. And most people feel fine. If you have pain, though, and you go to the doctor, they are probably going to find something wrong in there. And they will, understandably, blame the pain on whatever structural issue they find. It's even more frustrating when they don't find anything, right? Then it's like, what the heck? In both cases, the brain thinks you need the pain. Maybe because you saw the x-rays or heard some horrifying medical talk, or maybe because of some unconscious stories going on, things your brain is doing that you aren't even aware of. But in this client, it was pretty much just the classical medical story. She had had cancer and some brutal surgery, so she was well acquainted with doctors and hospitals and pain. Her brain probably just came to expect pain. She had some other things going on. A parent had died when she was a teenager, and that sadness and frustration came out pretty easily. We dealt with that with some quick hypnosis, and she instantly felt a lot more at peace. Whether that had to do with the pain or not, who knows? But why not get it all done? When she was absolutely satisfied that she didn't need the pain anymore, there was no reason for it. Despite having arthritis, we could move to the pain relief phase. This is a tricky part because a lot of people say, no, I don't need the pain anymore, but they still think it has to stay because they can't let go of the medical story. You don't understand. The doctor said, yeah, I had a doctor as a client once, and he knew what I was saying was true. But it's different when it's your own pain. It feels like something is messed up right there where it hurts. And that's why it's important to get these things checked out first before doing any kind of negotiation with your unconscious mind. You don't want pain turned off if you need it, like the guy with the nail in his head. There are other reasons besides a medical story why your brain may hold on to pain. Sometimes the pain is proof of another kind of hurting when you can't prove it any other way. One of my clients had been psychologically abused by her husband for years, and she developed terrible pain that she knew was from his carelessness in an accident he caused. Without the pain, she had nothing tangible to show other people how badly he'd hurt her. Sometimes the brain links the pain to an emotion that was present at the time of the accident. There are hundreds of pain stories. You just have to figure out what yours is, or get your unconscious mind to drop it without knowing. But my client with the knee problem didn't seem to have anything like that going on. So we set up a signal to talk with her unconscious mind, and we asked it if it were willing to get rid of the old pain signal. It said yes. So we asked it to go ahead and do that. And then I guided her through a relaxation process, a hypnosis, to let go of all the tension and muscle clenching and expectation of pain. And when we were done, her pain had dropped from an 8 to a 1, barely noticeable. I checked with her a week later and she was doing well, but her hands still hurt. The electric shocks were gone and she was walking without pain. So we worked on her hand, and last I heard, she was very happy. Can you do this on your own? A lot of people can. I bet you can. But it depends on a few important things. First, you have to actually believe what I'm saying, that pain doesn't equal injury. You probably have a horrible sounding diagnosis, and it just sounds crazy that you would not have pain, given all that the doctor said and showed you. That is the hardest part for most people to get past. But it's simply true. I had really bad back pain for a long time, and I've got the typical abrasions and fused vertebrae and x-rays, all that stuff. Well, when I read about how pain is caused by the brain in a book by Dr. John Sarno, a light went off in my head. And I just asked my brain to turn off the pain. And it did. Every now and then it starts to come back and I just say, no, 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 no. And it goes away again. My wife had a colleague recently with terrible back pain. And she told him about the same book and his pain went away. He didn't even have to come see me. So second, do you really want to be free of the pain? On a superficial level, of course, we all want to be free of pain, but sometimes deep down, a subconscious part of us doesn't. You have to be honest with yourself. What would that mean for your life to be pain-free? Some people know that their spouse would leave them if they had no pain, for example. Some people would have to go back to work to a job that was killing them. I have a good friend who is on disability because of pain in his shoulder, and whenever the pain starts to die down and he tries to go back to work, it flares back up. He's not doing it on purpose, but I don't think his unconscious mind wants him to go back to that job. And migraines are terrible, but if you never had migraines, would you have to do some things that you'd rather not do? This is the crazy logic of the unconscious mind. Nobody's doing this on purpose, but you have to call it out and explain it to your own mind. Stop giving me migraines. I can just say I don't want to do it, or I can accept that my spouse will leave me, or I will find a different job. And third, can you find your pain story if it's not one of these things? You can, of course, just ask your brain to turn off the pain, whatever the reason for it was, and wait. If after a little while you're not feeling a lot better, then you can start to do a little digging. Even if your pain started because of an accident or sickness like COVID, think about what was also happening at the same time. Did you move or start a new job? So much pain is linked to moving. It's incredible. Did a person close to you die or move away? Did your mother-in-law move in with you? It sounds crazy, but these things can get linked in your brain subconsciously. Hypnosis goes straight to the subconscious, but you can get there yourself with some patience and quiet reflection. But if you don't have time for that, there is a quick and easy exercise that you can do to lower your pain fast without really thinking about it. Knowing what you know now will help. Your brain is already considering it. You can do the exercise right along with me in this video, an easy exercise to lower pain fast. See you there in a second.